Welcome to our latest podcast, which is the fourth in our series. And we're delighted this year to be talking and celebrating T-Level Thursday within National Apprenticeship Week. So I'm really, really pleased to welcome some special guests. But if you don't remember, my name's Lisa Ferris and I'm the Apprenticeship and Careers Manager at Glos Hospitals NHS Foundation Trust. And I've got with me today three special guests. And those guests are Sarah Pinkney from my team, who leads on T-Levels, and also two T-Level students that have been with us and are currently in their second year and have been on placement with us. So that's really, really exciting. So just some background. As an organisation of our size and variety, we decided to look into T-Levels about 5 years ago. And we did a lot of research and background and took some good things, took some lessons learnt from other organisations and decided to kick off with T-Levels in health. And fast forward, I'm going to hand over to Sarah to say how we managed now to increase our numbers year on year and have some really, really great success stories, but I'll save that for later. Sarah, over to you. Can you just tell the listeners, if they don't already know, what a T-Level is?
So a T-Level is a 2-year post-16 qualification and it's 80% in college, so study, and then 20% on placement within the trust. And it's the equivalent of 3 A-levels.
Brilliant. Okay, yeah, that's great. And we're working with local colleges, I believe, in the county.
Yes, we are, yeah.
Yeah, okay. And today we're just going to be talking predominantly about our health T-Levels, but we are looking to expand that. And you're leading on T-Levels at the moment, so there are other areas that T-Levels are coming on at a pace, and we are looking at other areas to host placements within our organisation.
We are. We'd love to support T-Levels in the healthcare science area, business admin and IT as well would be brilliant in the future.
Yeah, that's great. And I think we've also started looking at the nurseries as well. So a real wide variety of T-Levels, which is a great way of introducing 16 to 19-year-olds, I believe, that come into our organisation and really know what it's like to work here.
Yeah, absolutely.
Brilliant. Thank you. So as part of the process, I started off this recording talking about the research and background that I'd done. But for the last 4 years, there's been that continual improvement and development of this initiative. So can you just talk us through kind of some of those initiatives that we now do to make sure that this programme is really fit for purpose?
Yeah, absolutely. So we work really, really closely with our local colleges. We have really good relationships with those and the tutors there to make sure that there's a plan in place for the year ahead. We like to get as organised as possible so that the students get the best experience that they can. So we do things like hold an information session and do a tour of the hospital so the students have an idea of what areas they're applying for and what it might look like. We do an application process so that we try and make it fair and equal for everyone and try and do our best to give people the experience that they want on placement. We give all of our students an industry placement booklet, which gives them all the details of what they need to know about the trust, but also about who to contact, who's there for them, what support's available as well. We host a parents' evening so that parents can ask any questions. It's quite a daunting experience as a parent to put your child or your young person in a school, in a hospital environment. And so we like to relieve some of those questions and those concerns that they might have. So we give that opportunity for parents or guardians to come along and ask away. And we host that at the hospital so that they can be in that environment too. The students also get to go on a pre-placement workshop where they find out about specifics to do with their expectations. So the uniform policy, sickness policies, what support is available for them as well. And within that, we do a ward orientations. They get to spend some time on the ward with their work-based supervisor. They get introduced to the team so that on their first day, they can be really comfortable and confident in where they're going and what's expected of them.
That sounds great. That sounds a really kind of robust robust programme. Having the parents and carers in that evening, I know I've witnessed some of those evenings, and we've had parents and carers, a full room of parents and carers, and asking loads of questions and really being able to speak to them directly, because can be quite a daunting thing for coming into a new organisation, let alone an acute hospital trust. So I think that has really worked well, and I'm really pleased we've had some great feedback on that as well. And also, I think it's kind of that stepped approach, isn't it, that we kind of keep them warm, and we're bringing those students in and they're kind of having a stepped approach before they're kind of just put in at the deep end. I know it still is the deep end, but I think there's that stepped approach, isn't there, that they keep learning a little bit more by coming in, getting a bit more orientation, etc.
Yes, over a period of about 6 months, realistically, that we are liaising with the students in the college, or discussing the students with the college around what works best for that person based on their location, their interests, their previous experience, their home experiences. We really do try and make it a tailored format, because we want to give these students the best experience of the hospital as possible, and what it's like, but also a real experience of what it's like working in the hospital.
Yeah, it's got to be a realistic, hasn't it? We don't want to sugarcoat anything, and we need to be realistic, but we also understand that there is that support needed as well. That's great. So let's speak to the real people here, apart from me and Sarah, that are actually doing this T-level and their experiences. So over to you, Cam. Would you just like to introduce yourself, who you are, what school perhaps you went to, and why you chose to do the T-level?
Yeah, so I'm Cam. I went to school at Forest Height in the Forest of Dean, and I've always wanted a job in healthcare, or to go into like the healthcare sector, but actually leaving college, I chose a computer science course, and then about 4 weeks into the course, I found I didn't like it, so I was researching courses, and I found the T-level, did some information about it, and got some information from colleges, and then I went and spoke to one of the colleges, and then they got me onto the course and sorted me out, and then I've never looked back since.
That's brilliant. Okay, so quite a jump from computer science to healthcare, but yeah. You've survived your first year and you're in your second year, so it must be made the right decision for you.
Yeah, it is, to be fair. I've never looked back since, and I've enjoyed my time in doing the T-level for the first year, and in the second year I'm thriving and going on and just finding my feet really on my own.
That's amazing. And being a young man in the nursing element, how are you finding that? How are you finding it?
I'm finding it all right, actually. It's daunting first, because you just think it's mainly going to be women going into the course, but actually going on to the hospital and onto a ward, you find that there's a general sort of mix, and that's what I like about it, and I can feel like I can be myself when I'm on a ward, and all the staff are really lovely, so I definitely feel like I've come out of my shell.
Oh, that's amazing.
Going on a ward and knowing that it's all right just to be a male HCA or staff member on the ward.
Yeah, HCA, healthcare assistant, isn't it? Yeah. But never say you're just a HCA, because they are a really, really important role in our organisation. So what does the future look like for you? What do you want to do after this T-level? What have you learnt on it, and what can you take away, and where would you like to go?
So on the T-level, I learned how to work on a ward and deliver patient care, but actually for my future career path, I don't want to work in the hospital. I'm actually going to want to work out in the community, and I'm going to study paramedic science at uni. So I'm going to use all this hospital experience to then take to me when I go on the paramedic science course, and use that knowledge to help me and hopefully better myself, and then be a paramedic at the end of it.
That's amazing. I think that's really great that you've got that aspiration to go in to be a paramedic, and this experience is going to really help you with that. Just to say, you talked about being on the ward and getting yourself kind of stuck into it. Lots of people out there might think that a T-level student might just come in and shadow and watch, but do you really get your hands in and get, stuck into everything?
So when you go into placement on a ward, it's not only that you just follow someone around and see what they do. You do that, but then they actually get you involved with the care. So I've been washing patients, going and taking people to places, so I've not just been walking around all the time just following somebody. So I've actually got hands-on, met the team, and know most of them, and I can actually find my way around a ward now on my own from that experience on placement on a ward.
Brilliant. That's great. Okay, we're going to move on to our other guest, which is Tilly. So Tilly, welcome. If you want to just introduce yourself and just say what school you went to and what you did after leaving school and etc., that'd be great. Thanks. Over to you.
My name's Tilly and I came from Chosen Hill School in Churchdown. I found it quite intimidating. I was in year 11 and everyone was kind of throwing at you, what do you want to do? What do you want to be? And at that time, I genuinely didn't know. But I went online and I found some taster sessions. I came to quite a few taster sessions, met some amazing people, got the real gist of kind of what everyone does, the different allied healthcare professionals. I think I went to a maternity session, I went to a paediatric session, and I went to a dietetics session. And overall, I found out that I thought I just wanted to be a midwife. And so I was looking around, I heard about the T-level course, and I thought that would suit me as it's more hands-on and it's more of a course for practical learners. So you come to the hospital and you can kind of get hands-on with everything and you can learn practically at college and then come and do your placements and put your learning into work.
That's great. So you've really taken advantage of what we as an organisation offer within our Taster Day. So to give you that snapshot of what's on offer. And it's lovely to hear that you went to a variety, because some people are better to kind of, and again, back to Cam about trying that computer science or going to that dietetics Taster Day and thinking, oh, that might be something I want to do. But actually, it's better than crossing those ones off. And there's nothing wrong with that at all. So your placement is in maternity.
Yeah, maternity.
And you want to be a midwife, which is fantastic. That must be quite different, quite challenging, different from a ward. And what kind of areas have you been involved in with midwifery?
So my course allowed me to rotate around all the different places in the women's centre. So I got to go on community, I got to go on the birth unit, watch some births, I got to go in the delivery suite, I got to watch some C-sections. So they really let you go everywhere. And antenatal clinics, you can meet people, really see their stories and connect with patients and really gain some really good qualities that you need to go into healthcare.
Yeah, so as a T-level student, you're with somebody all the time. You're not left on your own, are you? We just want to make sure people out there know that. And you've obviously had the privilege to watch some C-sections and some deliveries, and there's been consent for those, hasn't there, from people to do that, which really gives you a really, really good insight of what it will know. What do you think you've learned about? Are you still really keen to be a midwife?
Definitely. It's definitely taught me that is definitely what I want to do. I mean, the taster sessions show you, they don't blindside anything. They show you everything. So it's kind of really proven that that's what I want to do.
And I suppose that's the great thing about T-levels, really, isn't it? That you can really absorb yourself as much as you can at college, that you can really absorb yourself into an organisation that is really what is going to be your job or career of the future, and you know really what it's going to be like. Yeah. Not putting anyone off going to university straight away, but and coming on placement, but like Cam alluded to earlier, really feeling part of the team and knowing where things are and knowing those things, I think, really helps to decide your career, doesn't it? And if it is right for you.
It's been a great experience, and it definitely feels right now. I've came and had this opportunity to come on placements.
Brilliant. Okay, so what kind of advice would you give anyone out there who's listening to this, either parents or people that are, in year 11 like you were a couple of years back, about taking up a T-level, the choices out there? You said, Tilly, that you didn't know about this option, and I think there are still many parents, carers and young people that don't know about this option. So what advice would you give them?
Definitely read up. There's so many social media platforms, even the internet has so many different varieties of what you can do. Definitely, my school had quite a few career fairs. Parents can also attend them. So there's a very big variety of things that you can do.
Brilliant, yeah. And Cam, I just want to come back to you because just before we started the podcast, we were having a brief chat. And a couple of things. The one thing I remember is when you came along to the parents' evening with your parents.
Yeah.
And you were really kind of like, am I going to be all right? Am I going to make a mistake or anything? And, you know, as much as we all as a team try to make sure you're prepared, you know, there's no other, we can't prepare you to actually take that foot over into the area. But was it really as bad as you were getting?
No, as you said,
thinking?
Lisa, there's sort of no, you can only prepare as much as you can going into a job like this while on the T level and going on to a ward. It wasn't as daunting as I thought it would be when I got on there. It was a little bit daunting, but it wasn't as bad as I thought it was going to be. To be honest, I actually did enjoy it.
Oh, that's good. That's good. I'm glad. I'm very glad. And the other thing I was going to mention is that we were having a chat beforehand and you mentioned that you were doing some bank work with us, which is an option we do offer to our students in the second year subject to criteria. And you've now worked on a different ward today. You've been on a shift and you're earning some money, which is great.
Yeah.
And you're getting to experience some other areas. How's that been? That's a big jump, isn't it?
I will say that it's definitely daunting going from being a T-level student on the ward to being a bank healthcare assistant because you're actually on your own. You're not shadowing someone this time. So if you go to a different ward from what you're usually on, like I did, you've almost got to sort of find out the layout of the ward, make sure you ask. One thing I will say is don't be afraid to ask anyone when you go onto a ward. Don't just get on with it because that's what I learned. I'm very much a person that I would just get on with it, but then I was asking people on the ward and they would tell me where things were and then I knew where to go for that, and then it made my life so much easier going onto a ward that I never knew.
That's great. And are you looking to go on to some different areas as well? You've mentioned about obviously the paramedic science is your future.
Yeah.
So are you just trying different areas as well?
Yeah, I'm trying different areas. So my shift today was in cardiology. The eventual plan is to go into A&E. So I'm going to try different areas and get different experiences and then see if I can get into A&E and probably just working there until I get on my paramedic like uni course or apprenticeship and then go from there.
That's amazing. Yeah, well, good luck. Very best of luck to both of you, really.
Thank you.
For those career pathways. And I'm just going to come back to Sarah now. And we started off the conversation about how we'd prepared and what a T-level is. And then Cam and Tilly have given us some great background from their perspectives. But some of the historic success stories we've had. I remember one young lady, she'd been in maternity as well, and she's now on her, she got offered 5 places, I think, at universities, and she's now studying at Cardiff to be a midwife, isn't she?
Yeah, and we've got another student who's working as an MCA over there as well, a maternity care assistant over in maternity.
Yeah, so we have kept a lot of students that have, gone into employment, and we've had another one that's gone on to the higher level apprenticeship of our operating department practitioner and also onto our trainee nursing associate higher level apprenticeship as well. So they've progressed with us as well, haven't they?
Yeah, we've had some really good success stories, really, really good. And I put that down a lot to the work we do with the work-based supervisors. So each student will get a work-based supervisor, at least one, as part of their support system on the department or the ward that they're on, and they'll work with that person throughout their placement as much as they can, so that they really build a bond with one person and that person can help them and support them through their programme and through their course. So if they're struggling in a certain area or if they need extra support in a certain area, but also that it helps with their continuation and just the settling in, because they're coming in one day a week. on the most part. It can be quite daunting having like that 6-day break. I think coming in and knowing that same person's going to be there to support them the majority of the time, and being able to catch up on the last week and what they've learned at college.
Yeah.
It also gives the opportunity for the student to work on something that they've been struggling with at college, and then come back and put it into practice
Yeah.
and talk to the HCAs who are working in the department about what they've learned.
Yeah, definitely. I think that's great, isn't it? So yeah, we've got this model where they come in 1 day a week, so they can reflect back with their college, and they can reflect back with their work-based supervisors. We wouldn't want anybody taking, burdens home, and that's why we give that time for that reflection with those work-based supervisors. So they are our existing staff, which do an amazing job, and we give them some skills and workshops available for them to develop to support these people. Any final thoughts from you guys? From the T levels, and would you recommend it?
Definitely recommend it. Just literally be yourself. Don't try and hide away, because I remember being at school and I said that I wanted to be a midwife, and kind of everyone was like, "Wow, why would you want to do that?" And it's just who I am. It's just what I want to do, helping people. It's just me. So, yeah.
Right. Look out, Tilly the midwife then in a few years. Well done.
Hopefully.
Yeah, well done.
Yeah, and on that note, when I've told people that I was going into a computer science course rather than healthcare to start with, they were really like, "Are you sure that's the right course for you?" Because everyone knows me as a caring, kind person. And then when I actually got onto that course, I then realised it wasn't for me. And then I went and did the T level and actually went to the course I wanted to do in the job I wanted to do. So I would definitely say research, and definitely make a final decision on what you want to do. If you want to do the T level, do all the research, get in contact with the people, go to the taster days and see if you want to go into any of the professions. And if you do, then contact the people who do the T level, like the colleges, because they can help you get all the way through. Like for me, with the placement on the ward, that helped me strive in my learning at college, because what I was learning at college I could put into practice on a ward, and then it helped me understand the learning at college better. And also, don't be afraid to ask.
No.
Don't be afraid to ask any questions on a ward or at college, because the more knowledge you have, the easier the job will be in a way.
Yeah, no question is a silly question, isn't it? And usually other people want that answer.
Yeah.
So yeah, if you are interested in T levels, you need to look at your local colleges, look on their websites. We've got some information on our webpage as well at Glos Hospitals. So it just leaves me to say a really big thank you, especially to Tilly and Cam, for coming today and talking to us. Thank you, and really the very best of luck with your rest of your T-level journey,
Thank
and
you.
more importantly, your future careers. Midwife and paramedic, look out. And thank you, Sarah. Thanks for all the support you do for T-levels.
Thank you.